Welcome back. Today we're joined by Dr. Mark Brown from our sponsors at Univera Healthcare to tell us more about the importance of having a primary care physician and their role in preventative health. Welcome, Dr. Brown, and thanks for joining me.
Thank you, Chelsea. So good to be here.
Of course, let's talk about why Western New Yorkers should have a primary care physician.
Having a primary care physician is so important because you need someone who understands you, understands your health, your conditions, illnesses that you may have suffered from. Having been a primary care physician for over 30 years now, it has become so important for me to develop relationships with my patients so I know them when they come in, and I can already predict some of their needs and the important issues that they need to discuss with me.
That's right. Okay. Let's talk about what type of doctor should we see for primary care.
So for most adults, you're going to see either a family physician or an internist, and the difference is minor there. Family physicians see all age groups, and internists just see adults, especially seniors. They're probably going to land with one of those two primary care physicians, sometimes with a geriatrician. But it's so important to have a team that works with you. For example, you can have that primary care physician that works alongside a physician's assistant or a nurse practitioner, and that team knows your needs, knows the medicines that you're on, the illnesses that you may be dealing with, so that you can go in and feel at home, not like going to the emergency department where you're an unknown entity, or an urgent care where they're figuring out things on the fly. Having a primary care physician is essential to really getting good long-term health care.
And then everything, kind of funnels through your primary care. So if you have to go to a specialist, the primary care can send all of the information that they've had over the years to make sure that specialist is up to date with you too, right?
Exactly. That's so important because each of us have our own unique challenges when it comes to health care. So it's critical that in one place, hopefully with one particular person, a physician that knows you well, you've got all your specialty visits, all your medications that as I've talked about. If you've ever had to be in the hospital, they know what you've been in the hospital for. So having that one person that understands you and your care intimately is critically important.
Well, sometimes it can be hard to find the right doctor. So do you have any tips on how to find a good primary care doctor that works for you?
Great question, Chelsea. It's challenging, number one, because there's not a lot of family physicians out there. There's not a lot of primary care out there. So you should really talk to friends, family, people you trust. Who have you seen? Who have you been able to develop a good relationship with? At Univera Healthcare, we have a Find a Physician site at univerahealthcare.com, where you can go on and see who's available in the community, who's accepting patients. But it's important to do the work, to do the legwork beforehand, so you can go in, if you don't already have a primary care physician, and find someone who can take good care of you.
Okay. How often do you recommend seeing your primary care doctor?
Well, especially this time of the year, that's really important. You should see your primary care physician if you're even in the best of health once a year. So Medicare patients, for example, have 2 free visits that the government provides for them. One's a wellness visit and the other's a complete physical. So you can go into those visits being confident that you don't even have a copay. But even if everything else is perfect in your health, you should try to see your physician at least once a year on one of those wellness visits or physical exam visits. And then, it's important if you've got a minor illness like a cough, cold, minor sprain, that you can call up your family physician, go in and be seen on an urgent basis, and you already have that connection with them, and hopefully avoid the emergency departments and the urgent care centers.
That's right. And going back to how this is all preventative, right? The importance of going in to see your doctor even when you're not feeling bad, just going to go get that yearly checkup and make sure that everything's right?
So important. I emphasize this time of year because this is the time of year you want to get your flu vaccine and get all those boosters that you need to make sure that your immune system is in the best shape possible for the flu and other respiratory illnesses that we know that are coming our way throughout the winter.
RSV. Alrighty. Well, thank you so much for coming in, Dr. Brown, and sharing more. And viewers, if you would like to learn more about preventative health and resources available to you, you can visit our sponsors at myuniveramedicare.com. Thanks again for coming in, Doctor.
Really appreciate it, Chelsea. Thank you.